Hi, Dr. Dee Pasquale, the co-founder of NSI Stem Cell, and I'd like to talk to you a little bit today about diabetes and overcoming that condition. What I want you to know is that I truly believe that you have everything you need to heal and achieve true health for life, and that's based primarily on my own experience, plus the experience I have with many of the patients that we've helped in the past. What I'll tell you is that diabetes, there's nothing wrong with your body. Your body is doing what it's supposed to do. It's adapting to a very stressful environment, and the environment is the problem. So in helping somebody overcome diabetes, we understand that patients are very frustrated. They're told from day one that there's nothing you can do about the condition. Somehow you're broken or you have a genetic predisposition for this issue. And ultimately, the best you could do is just live with it and take medications to manage it. But that's not true. It's not true based on the experiences that I have, and I'll share those with you. I'll tell you a bit about where I come from. I'll talk to you a little bit about why diabetes is a worldwide epidemic, and if something isn't done about it, we will have a serious problem in the future, at least for future generations. So where I come from, very simply, is I come from an environment that, we were taught. I'm Italian American. Obviously, you can see by how I use my hands. I was raised in an environment where we ate lots of pasta for breakfast, lunch, and dinner. I tell this story quite a bit. And as a result, every one of my grandparents died of end-stage diabetes, and I watched that process occur with each and every one of them, and it was really a horrific position for me to be in as a kid. I watched this growing up, and I watched them go to their doctors. I watched them take all of their medications. They were great patients, and they never improved. In fact, they got much worse as time went on, and the quality of their life was not very good. I mean, my grandmother died with severe neuropathies and Alzheimer's and dementia. My grandfather had limb amputations and ultimately died with kidney disease. Both were never healthy as long as I known them, and I knew that, for me, I was scared. Ultimately, I thought, because everything I was told was the same thing that most people are told, is that diabetes is genetic, and I thought that that's something that I was going to develop, as I aged. And what I found, and what I know to be true now, is that diabetes is a lifestyle disorder, and all of the habits that they taught me, if I continued to do those things, yes, I would develop those diseases just like they did. So I use that information, and I use it to help people, and I use it as a platform to help people understand that there is hope. There is hope in preventing the end-stage complications of this disease. What's important to understand is that if you just manage your diabetes with medication, the chances that you'll develop end-stage complications, they're like 90% based on the literature, and that's not a good thing. The quality of your life will most certainly get worse as time goes on with this condition, because it is the only condition that we know of that affects every cell in your body and causes damage on a system-wide level. So we know that it's bad. We know that we don't want to enter the end stage. What can we do about it? And that's why I'm here. I'm here to show you the process by which, the one that we developed over many years, by which we can take a diabetic patient and make them non-diabetic in a very short period of time using a different set of tools. So again, for me, I'm very blessed. I because of the work that I do and because of the platform that we've created, I've been involved in some really exciting things. We've been featured on the Discovery Channel. I was the head doctor in a show called Reversed, which was a show about reversing diabetes, which was really cool. We had the opportunity to take 5 individuals to Jamaica. We put them in a house and we let them kind of learn the tools necessary to overcome their disease, and then we treated them when they came back to the States. Every single one of them were able to reverse their diabetes, which is really neat. And one of the primary reasons why we did that show is because the executive producer, his name is Charles Maddox, he was one of our patients as well. He reached out to us because he was struggling with diabetes and wanted to take part in the protocols that we've designed. And here's a trailer for you to watch just to kind of take a look. It was a really great experience.
My name is Charles. I made my name known as a celebrity chef and award-winning filmmaker. 8 years ago, I was diagnosed with type 2 diabetes. It would set me on a journey to not only try and save my life, but ones I would come to meet around the world. It does not take much effort to live for others, and what we leave is how we will be remembered. I will embark on a road to help reverse the lives of some that are fighting this terrible condition. I hope at the end, we can see that hope is a great thing and the start of a better future. Welcome to Reversed.
So for us, in terms of helping people overcome this disease, it's a really important part of who we are, not necessarily just because of the patients we get to treat. And we've treated 15,000 patients worldwide with this branded proprietary system that I'm going to explain in a sec. And for the most part, it's about changing the culture, changing the healthcare paradigm, not just in our country, but worldwide, and letting people know that there are solutions designed to improve health and to repair and regenerate tissue. And I think that's an important thing. So for the most part, we came up with a process. It's called the True Health Framework, and it's really very simply our process by which we get individuals well on all levels. And there are 4 R's associated with it. There is repair, reset, restore, and refuel, and each one serves a specific purpose in taking an individual who's chronically ill from that state of chronic illness to a state of health over time. So what I'll start with first, the reset process. The first thing we have to do is we have to reset the metabolic state so that we can promote optimal healing at the cellular level. This is achieved by working directly with the gut and the liver to promote normal detoxification pathways, reduce inflammation, and to optimize the absorption of nutrients. This is a powerful functional medicine protocol to pull you from a period of crisis and bring your metabolism back online. The important thing to understand from a diabetic standpoint here is essentially that process is designed because we cannot implement just a diet at this stage of the game and expect you to be successful. We have to reset the metabolic system first. Then we can be very successful with dietary intervention. The next R in the process is the repair process. And what that really represents in this environment are stem cell therapy and regenerative medicine. When we talk about repair, we're talking about repairing and regenerating specific tissues. One of the primary differences when it comes to repairing tissue in the body between what we do and traditional medical interventions is medical interventions primarily rely on medication to deal with symptoms associated with a primary issue like a diabetes. But at the end of the day, those symptoms are variable and medication can only mask them for a short period of time. What we're doing in this environment is we're getting to the root cause. We're getting to the problem that's creating the symptom, which is glucose dysregulation or more glucose in the blood than we would like. And by repairing specific tissues, we're now able to not just effectively treat the condition so that we can make it asymptomatic, but overcoming the condition long term. So studies like this are very useful because now it's outlining everything that we see in clinical practice in terms of the mechanism by which we can affect diabetes, and it's really very exciting. So this one was published in Diabetology and Metabolic Syndrome, which is a peer-reviewed journal, and it was published in 2017. And what it does is it talks about what stem cells do once they're present in the intravenous circulation of an individual. So what we do with stem cells is we harvest them from that person, from peripheral tissue, and we isolate them on the patient's behalf and then insert them or inject them into the intravenous circulation so that they can have an effect on the entire body. With a diabetic individual, it's an extremely important part of the process because now it allows us to do the things that we've written here on the pad, and it's pretty amazing stuff. So this in the middle is MSCs, which are mesenchymal stem cells, and essentially they have the ability to do multiple different things, and all of them are beneficial for diabetic patients. What's really cool is we get insulin resistance we can ameliorate or get rid of insulin resistance by upregulating insulin receptors, which is really important. From a diabetic standpoint, it's insulin resistance that creates this problem. But as we approach the end stage, we also get damage to the islet cells of the pancreas and we don't produce enough insulin. So this is the mechanism by which we can protect the islet cells, the insulin-producing cells. This is a mechanism by which we can differentiate and produce more insulin. And this is a mechanism by which we can regenerate the islet cells or the insulin-producing cells in the pancreas. So as you can see, the literature is really very clear in terms of the mechanism. And we know that when we obtain stem cells from an individual, so long as they're the right type, when we inject them into that individual, that mechanism will take place and we will be able to heal that individual on a grand scale. So when we put stem cells in, not only do they do these things for diabetes, but think in terms of repair and regeneration of the cardiovascular system, the lungs, the liver, the kidneys, immune regulation, which is really a tremendous part of this disease, especially as it enters end stage. Now, with the repair portion of the True Health Framework, we talked about reset. When we repair things, we now have the ability to affect someone on a grand scale, and we can have a long-term benefit, not just symptomatic change. The next step in terms of the True Health Framework is basically the restore portion. With restore, our goal is health for life. So once we repair, we must restore function. This is true for joint-related problems as well as metabolic problems like diabetes. Think in terms of diabetes as a physiological state in terms of our physiology, and it's adapting to something very specific, which is chronic stress or a chronically stressful environment. So here what we need to do is we need to restore a normal physiological state, which is one that is designed to promote health. In this stage, we're returning your physical body and your physiology back to a state of strength, stability, confidence, and the ability to do more and enjoy life. More importantly, when we're talking about diabetes and restoring normal physiology, we don't do it just because we care about glucose and A1C. I personally don't even care about those things because I know that they're transient, meaning that they can change based on foods we eat, they can change based on our mood, based on whether or not we moved for the day in terms of exercise. So the real concern is the end stage complications associated with this disease. So by restoring physiology, we're able to put that person in a state of health so that we can prevent those complications. And those are serious things. Again, I don't care about glucose and A1C. I care whether the individual is going to have a long-term quality of life and be able to do the things that they enjoy, be able to take care of their family, and not suffer from those complications, which can be very, very significant. Things like cancer, heart disease, stroke, neuropathies, retinopathies, kidney disease, limb amputation, poor wound healing, Alzheimer's and dementia. These are really significant problems, and we need to prevent them. And that leads us to the next stage in the True Health Framework, which is refuel. Once we restore physiology, once we've reset, repaired, and restored the physiological state that promotes health, now what we have to do is maintain it. And refuel is the next portion of that process. And basically, it is ongoing nutrition and lifestyle counseling. Now that we've overcome our health challenge, let's keep it that way. This is your maintenance plan and how we remain healthy for life. So if you're frustrated and you're tired with the same old, drug after drug and no improvement long term, if you're tired of being fatigued, if you're concerned about the future in terms of your health, then I would ask that you look into a process like this. We've been able to be very successful with individuals, not just because of who we are and what we know and our experience, but more importantly, because of the tools that we bring to the table and the passion that we bring for helping people. That's really the key from our end. So what I'd like to do is I'd like to show you a couple of the patients that we've been able to help over time. And I think you'll be quite pleased with some of the outcomes that we've been able to achieve. And we can achieve the same with you. So I'll introduce you first to Marjorie, who was one of the participants in the show that we did on Reversed. And before, it's interesting, when I spoke to Margie on site or on set, she was really skeptical. She was really tired of the same old medication after medication. She felt hopeless. At the end of the day, one of her doctors told her that she was allergic to vegetables, which was a really significant thing for me. I think that put her in a position where she felt like she was really just broken and wasn't able to overcome the problem. I was able to change that mindset with her. And after about 3 months, you can see her before here. And after about 3 months, these are her labs. You can see that the first one we did was in April of 2017. Her A1C was 7.7, which is significant. Her glucose on that day was 151. And just 3 months later, her A1C was down to 5.3, which is a normal level, not even pre-diabetic. At that stage of the game, she had neuropathies and she had retinopathies that she was really concerned with. She was losing her sight. She had tingling and numbness in her hands. Those things were greatly improved after only a 3-month period. And you can see how much weight she lost. She looked fantastic, and she was very happy with the results. With Charles Maddox, who is one of the individuals, he was the executive producer of that TV show, and he was actually one of our patients. And what I'll do is I'll let him tell his story, because his testimonial is really a great one. We were able to help him on a level that he was so happy with that he decided to become a diabetes advocate. His island country of Jamaica, which is where he's from, just like many other parts of the world, diabetes is running rampant because they've gotten away from their traditional culture. And as a result, they're eating foods that aren't genetically congruent for health, that are creating sickness in their culture. And it's a really big deal, just like it is here in the States, as it is worldwide and in many developing countries, as well as many established countries like China. We are seeing that the rise in diabetes and prediabetes is exponential, and we're not helping people overcome it outside of what we do. Traditional medicine just doesn't have an answer. So go ahead and listen to what Charles has to say. It's pretty interesting.
My name is Charles Maddox. I'm a celebrity chef seen on CNN, Dr. Oz, The Today Show, also a best-selling author and world diabetes advocate, and also the executive producer of the first ever diabetes reality show, Reversed. I teamed up with NSI probably about a year and a half ago. Dr. Vincent D. Pasquale is the doctor on the television show, and his wife Teresa is actually the trainer on the show. Now, I had heard about stem cell therapy, but like most of us, I didn't know much about it. They introduced me to it, and I was actually shooting a documentary based on diabetes called The Diabetic You. So they offered to give me some stem cell therapy, some stem cell treatment, and like most people, I was probably a little reluctant until I did some of my research and started to look into what stem cell therapy was and the benefits that stem cell therapy actually has to people with diabetes. And it was amazing. I remember I had flown probably about 4 weeks after I had stem cell therapy to New Orleans to shoot a segment of the show, the documentary, with a big medical center out there. So we had done all my labs and everything like that to see where I was with my diabetes and the progression and how good I was doing. And to my amazement, the labs came back and the doctor said, "Charles, you can now come off of your diabetes medication." This was only literally 4 weeks after I had stem cell therapy. So I don't know if it was, of course, part of the hard work that I was doing, but I definitely attribute some of that to the stem cell therapy treatment. So much so that some of the guests from the show, 3 guests from the show, I wanted to have on and meet Dr. Vinny and NSI, and they were also treated with stem cell therapy. Marjorie, who is a sweet Latin lady who I love dearly, who has made some amazing changes in her life, received stem cell treatment. From her doctor, she was able to come off of her diabetes medication. Jerome, who is insulin dependent, was cleared after stem cell treatment weeks later to be able to come off of his medication for insulin. Lisa has lost, since her stem cell treatment, has lost over 60 pounds, has reduced her insulin 80%, and it's just getting started. So I really want to be able to introduce stem cell treatment and the work that NSI is doing to a lot more people who have diabetes and other conditions that this type of treatment can help. So I'm excited about the future, because this is the future, actually. And we really have to be able to take our own health into our hands, because we live in a world right now where insurance is changing. Many don't have insurance. We only are getting a few minutes of our time with our doctor, our primary care physician. People are lost and confused on which way to go. So having an alternative, having another option like stem cell treatment it's a gift. And definitely we have to look into it and really look at the possibilities of how this can improve our life. Because like I said, it's improved mine, and a lot more to go.
So if you're watching this and you're frustrated with the care that you're receiving and you're unhappy with the current state of your health, or you're extremely concerned of what the future holds in terms of your health and your ability to function, then I ask that you reach out to us. This process will work for you just like it has for thousands others that we've treated. And we're very passionate about making change in the world, not because we care so much about you. We care about you, but we care more about your circle of influence. We want you to role model for your community. We want you to role model for your children. We need to break the chain of chronic illness because it is habits that we pass on to our children. It is not a genetic disease. It can be overcome. And if it's something that you're interested in, we ask that you reach out to us and we'll provide a link. But before we do, I'd like you to take a look at one more case study. His name is Chris. He was an individual. He was 53 years old. He came to us. He was, I'll never forget him. He was a finance manager at a car dealership. And essentially he could not function anymore. He was completely fatigued. His biggest issue was that he couldn't get life insurance for his children. And he was very upset about that because he had uncontrolled diabetes. And as you can see on the labs that we have up, is in a very short period of time, his A1C was 10.5. If you're unfamiliar with A1C, A1C is a measure of blood glucose over time. It's a more sensitive measure. And when we get to an 8.0 or higher, it represents uncontrolled diabetes, and the likelihood that we'll have significant complications are very high. With him, it took a little bit longer to normalize, and I'm happy to say that that last value of 6.3 is a very good value, but he's much lower than that. He is non-diabetic. He is off all of his medication, and it's 3 years later. So the tools that we taught him with the True Health Framework were truly lifelong tools that are designed to educate people to do what's necessary on their end to achieve true health for life. And we'd like to do that for you as well. So if you're interested in seeing if we can help you with your condition, everyone is a little bit different, and an analysis would be necessary on our end. We will take the time to do a full history and functional analysis, lab work if necessary, so that we can determine if we can help you as well. If you're interested in that, please give us a call at the number below or click on the link so that you can fill out an application, and one of our representatives will be with you very shortly.